some of the most concerning things that we collected in terms of information were their observations about increased patient harms, right? For instance, differential treatment of patients who were unvaccinated for whatever reason, right? It's their right, informed consent. However, they're treated very poorly, even in insulting ways. So some of the descriptions were, really harrowing. And then these changes after the vaccine rollout, and many of the protocols that, you have protocols, you don't take them as, sort of biblical commands, but you some guidelines to proper behavior in the health professions. And those were kind of thrown out the window. Like, you have to obtain informed consent from your patients. You cannot force them to do something that they are, in principle, very opposed to doing, right? You can't ram over them, etc. So all those things, as these workers reported, were thrown out the window. And there were a fair number. So even if it's a minority, it doesn't matter. It's like an ethical issue, right? It's not a battle of, who's the majority, right? The mob rule. So that's another one. Then I said, okay, am I really seeing this, or is it my own bias, right, against forcing people against a medical intervention that they don't want and, in my opinion, they don't need? And I said, okay, well, there are standards, independent standards, right, of both evidence and ethics. Of course, the ethics, as everybody knows, is the Nuremberg Code, that you don't violate informed consent, et cetera, et cetera. But let's look at very official OECD, Organization of Economic Cooperation and Development, right? All the, the so-called democracies or capitalists or whatever you want to call them, right, got together, and this is, quality framework to evaluate policy. Is the policy relevant? So I measured my results against this framework, and the policy failed on all fronts. Does the policy address a well-defined problem? No, it doesn't, right? It misrepresents vaccine hesitancy as ignorant and ignores the structural roots, and vaccine hesitancy as ignorance. Well, I looked at the medical data. These people weren't ignorant at all. They were actually excellently well informed, right? Effectiveness. Does it achieve the stated goals of protecting patient care? No, it doesn't. Quite the opposite. It undermined patient care, right? Not only because of the impact on the system, but also the impact on the patients themselves. Efficiency. Are they investing reasonable amount of resources for the outcomes alleged or desired? Well, no. It triggered mass layoffs, health losses, and mental health crisis. Now, by the way, if you go to the official authorities, they will deny this. They say, no, we didn't lose too many workers, right?